Have you ever had the situation where the doctor tells you, let's do an NGS? So is NGS, is it a test, or is it a procedure, or is it treatment? So my name is Dr. Arun Chandrasekharan and I'm a medical oncologist. Today, hopefully, I'll be able to shed some light on what exactly NGS is, which are the type of patients that need NGS, and whether it actually makes a difference. So what exactly is NGS? NGS stands for Next Generation Sequencing. What it does is, this test basically scans your DNA and detects errors or mutations, as we say, which may help against the treatment of cancer. So this is very similar to a barcode scanning which happens in department stores, where the cashier scans the barcode and gets the details about the product. The same way NGS scans the DNA to get details about any errors or mutations. Another analogy would be, our body is like a huge book, or let's say an encyclopedia which has more than 25,000 or 30,000 words. So what NGS does is, it screens through all the texts like an editor and finds out the mistakes in the whole text, thus enabling you to target those mistakes and correct them. Who requires NGS? So NGS is an important part of cancer treatment, especially in diseases like lung cancer, ovarian cancer, prostate, colon cancer, and genetic cancers. So when we talk about lung cancer, not every lung cancer patient is the same. A patient will respond to one line of therapy, the second patient may not. So why is this difference? It's because the intrinsic DNA inside each of these patients is different, so they need to be targeted separately. For example, we use NGS to detect mutations in lung cancer, and we target EGFR with a single tablet. So if we have an NGS positive for this mutation called EGFR, all you need is a daily tablet. Secondly, we use this to detect MSI high mutation in patients with colon cancer. So here you have an abnormality which can be treated with not chemotherapy but immunotherapy, which has far less side effects compared to conventional chemo. Now, how is NGS done? How is this test conducted? So there are two types of NGS. One is the tissue NGS and the second one is the liquid biopsy NGS. Tissue means it's taken from the biopsy sample of the patient, and liquid biopsy means that it's taken from the blood. The tissue sample can be used from a previous biopsy which may be already there with the patient, so you won't need to go in and prick the patient or cause any pain while conducting this test. For a liquid biopsy, a sample of blood around 10 ml is collected and it is sent for the testing. These tests are available both outside India and within India. The tests which are available outside India, like the Foundation one or the Guardian 360, they are more expensive, costing close to 2 to 3 lakhs, but these labs have a huge database of information and probably give, better results. But in India too, now up and coming, we have many new labs which give excellent results as well for far lesser costs, ranging between 50 to 60,000 rupees. So in conclusion, NGS is a test that's here to stay. It gives you a smarter treatment rather than just conventional treatment. There are many patients who can benefit from NGS and certain targeted therapies as well. Thank you.